There has been a 25% increase in the admission of asthmatics to the Queen Elizabeth Hospital. One doctor there believes volcanic ash has been a contributing factor.
Yes, asthma has increased. Post-volcanic ash. We've seen a 25% increase in cases, but during COVID we had a diminished amount of cases of asthma. But when you consider the cases pre-COVID, COVID and post-COVID, the rise is not as significant. Typically in the early days we would see 25 to 30 asthmatics a day. During COVID that dropped significantly. And now with the volcanic ash it has a 25% increase. One of the things that I think the decrease was is that people were they were sanitizing, they were more conscious of their surroundings, and the biggest problem with the volcanic ash is the fine particles. The fine particles, even when you wear a mask, can actually get in, and the presentations that we are seeing are nasal congestion, because that's when you breathe in. People are complaining of heaviness in their throat. They also complain of tightness in their chest. I am sure you have been involved in ash removal, and one of the issues that causes asthma is exertion. So people who exert themselves are getting exertional asthma on top of their regular asthma. And they're the ones who are coming in more distress than the others.
Not only are asthmatics battling volcanic ash, they're doing so in the midst of the COVID-19 pandemic. As a result, there has been a change in the treatment offered to asthmatics at the Accident and Emergency Department of the QEH.
Asthmatics are given priority. I think that's the first thing that we have to realize. And this is not just now, this is going back to times of 1990 when the department first moved downstairs. One of the issues that we have is that when you look at asthma, it is a breathing issue and the person is scared. So when they're brought in, we have triage nurses who assess them. So what you do is you look at their breathing pattern, you look to see if they're using their extra muscles of breathing, and if they are, then they're brought in immediately and given nebulizations. Now let us just jump to that issue of nebulizations. In the older time, pre-COVID, what we did is you would come in and you'd be nebulized 3 times. Okay? And people got accustomed to that. Studies have shown that you can use a meter dose inhaler. And people say, what is a meter dose inhaler? That's your Ventolin inhaler. Your Ventolin inhaler with a spacer can be just as effective as nebulization. And when they come into the department now, that is how we are treating them. What one wants to do is to decrease the aerosol, producing aerosols with COVID in it that may affect other people. And that is how I think some of them may think they're not getting treated appropriately. But that is just as effective.
Dr. Watson is warning that even though most of the volcanic ash has been removed, the lingering ash can still cause respiratory problems.
It's going to be in the air for a long period of time. The issue that we have, and one of the things that I want people to understand, is you've closed your house. The air is damp still. There are all sorts of things that off gas in the house, which is garbage, etc. The other thing that one has to be aware is that the fan, everybody is going out, and if you try to buy a fan in Barbados, you may be lucky. You need to clean that fan every 2 to 3 days. Because if you pass your hand over the blades and you look at your fingers, you're going to see the fine dust on it. And that is something that I don't think people really appreciate. Wiping down of the counters inside the house. They're very busy power washing outside, but then they forget that inside also needs the same level of detail. And for us in the emergency department, we are grateful for prevention, because we have other things, and we have COVID-related issues, non-COVID related issues, and certainly the respiratory issues that will be coming now could really be problematic for us. From the respiratory component, prevention, wear your cloth mask and a surgical mask. If it is optimal, get a KN95 mask. The best would be a respirator. But we don't have enough to go around in Barbados. And make sure that you wet things down before you start your cleaning. And the clothes that you wear shouldn't be trudged through the house, because if you have an asthmatic in there, then that dust will also affect them.
Stay safe, protect yourselves and your family.